Hi, I'm Susan Hatters-Friedman. I'm a forensic psychiatrist, and I'm an associate professor at the University of Auckland and also affiliated with Case Western Reserve University School of Medicine. Today I did a workshop at the American Psychiatric Association meeting with colleagues regarding gun violence and the mentally ill and what is psychiatry's role. The colleagues I did the workshop with are Renee Sorrentino, Bish Jain, and Ryan Hall. And we talked about the pros and cons of psychiatry being involved in the gun control debate, as well as the pros and cons of restricting the mentally ill from owning firearms in the United States. So when you think about the pros, they may be fairly easy to think of, such as especially if you're opposed to gun ownership, that less of the population would own guns if we restricted the mentally ill from owning guns, and that our patients may have decreased rates of violence perpetration or suicide if they're less likely to own guns. As well, it may seem that mental illness will get more education, more treatment resources, because we'll be identifying those with mentally ill. However, the flip side of that is that it may actually be that the legislation is just looking for the identification of the mentally ill and not necessarily following through with the treatment of the mentally ill. So when we flip to think of the cons about identifying the mentally ill regarding the gun debate, we need to think of them as cons to the patients and then cons to the field of psychiatry, I think. So potentially some of the cons for identifying the patients with mental illness in the gun control debate are the erosion of trust with psychiatry, less patients coming for treatment to psychiatry because of concerns of stigma is a big concern. Also the concern of scapegoating our patients with mental illness. Oftentimes, for example, when the mass media talks about violent acts that have occurred, mass shootings, etc., they look for some signs or suggestions of mental illness without thinking about how common it is that someone's a loner and they're not violent, or thinking about how common anger is without the person having a serious mental illness and perpetrating a mass shooting. So we need to be concerned about our patients being the fall guy in this situation as well. When we turn to the risks for psychiatry as a profession about thinking about reporting our patients, the concerns are, for example, becoming a de facto agent of the state. The patient comes to us, has a serious mental illness, and meets the state's criteria for reporting. Then do we become sort of an agent of the state rather than providing treatment, which is what the patient came to us for in the first place. As well as a field, a lot has been written on our ability to predict violence, which is quite fraught. And so is it based on our own psychiatric risk assessment? Do we have to use risk assessment tools? Or is it just our own personal opinion about the person's risk? And also our risk of liability potentially increases. If we have not reported a patient who then commits a dangerous act, we can be scrutinized, perhaps unfairly as well. So these are some of the issues that we talked about in our workshop today about the pros and cons of targeting the mentally ill in gun violence legislation. Thank you. Is that okay?